Necessarily reflect those of the advertisers, owners, or management of Pacific Telestations LLC. For comments, opinions, and questions, please email Jess Lujan at jessthebuzz@gmail.com. The Buzz with Jess Lujan.
Good evening, Guam. I'm Jess Lujan. Welcome to this edition of The Buzz. Again, so glad you could join us tonight. Again, my studio guest for episode number 3, of course, Senator Dennis Rodriguez Jr. And tonight we'll be talking about bills that he's introduced, and there was a series of about 10 bills that he introduced in regards to health care and some of these things, of course, looking at the L's of course, healthcare in Guam, and some of these bills looking at to address those ills. Good evening and welcome back.
Good evening. Thank you very much, Senator.
You have a bill. I don't know quite the numbers, and maybe it doesn't really matter the numbers at this point. But you have a bill in regards to I guess a subsidy for Medicaid and also MIP.
That's right.
Go Medicaid first.
Sure.
Okay.
Great.
Go ahead.
Thank you very much again for having me here. A few weeks ago, I introduced several bills. It was 10 bills, and at that time we said we're taking a systems of care approach of the healthcare challenges, right?
Okay.
And this was really 2 years worth of work. First, the first objective was looking at how do we sustain our hospital, Guam Memorial Hospital. And when we discussed it and looked into it further, we knew that we looked at 30, 40 years of the hospital operating, and it was the same problems, the same solutions we were providing, then. So we had to go back and look at the root cause of the problem. Why is our hospital always coming back to where they're at? If you take a look at it, you have a big majority of people there that come there without the ability to pay, right?
Non-payers.
Non-payers. These are non-payers. And the people that we're seeing there are sicker. These are people that have waited when their illnesses could have been prevented and could have been addressed earlier on, but
and they don't have primary physicians.
That's right. Yeah, so we Bill 132 deals with expanding Medicaid, which is the federal program. We get 55% of the funds that we put out comes from the federal government. We have to match it 45 cents for every dollar. And so we in 2010 Guam received a significant amount of Medicaid funds from the Affordable Care Act, pursuant to the Affordable Care Act. There was a $268 million Guam received. States receive them, the other territories receive them. For the territories, as we know, the treatment of Guam in the Affordable Care Act was terrible. We weren't afforded the same treatment as the states, where they were given the same money, a bigger allocation, but they were able to use it without any match. And as the year progresses, then they have to come up with their 10%, 20% match. And so that's what we have. So we did a good job. Public Health did a good job. Tess Archangel, who runs the Medicaid program, really did a good job in getting as much people into Medicaid, finding local dollars to match and draw down from that. So we have about $170 million left in that account.
And you say some of that money has come in as a result of the Obamacare care.
Yes,
right,
that's
basically.
right.
Now let me ask this, because as we speak, there's, I don't know if it's going to pass. I know the Republicans. I know the House, I think, passed their version.
That's right. They repealed it, the House.
Yeah. The Senate is. I don't know if it's going to pass, but there's one thing that's for sure, is that we don't know how much longer Obamacare or the Affordable Care Act is going to survive.
That's right.
And if it does survive, what parts of it are going to survive?
That's right.
And whether those parts that survive are still going to go to fund, as public health is I guess living on, basically.
Right.
So in moving forward with this, how do you move forward not knowing what Congress is going to do? Because based on what they're going to do and its survivability of what will come to Guam, it's going to determine.
It's unknown, yes,
it's going to determine whether or not this bill passes with that coming in with the same amount, if not more or less.
And we've taken that into consideration. And the beauty about this plan is that it really gives us the ability to make the call with the resources we have in our fingertips. We know the federal government is going to continue funding Medicaid. How much? That's the unknown. Is how much? Whether they're changing it into a block grant system. Those are the unknowns. We know what we know for sure too is that money that we received that was allocated for Guam up to 2019. Up to 2019. However, in our discussions with the Health and Human Services. We've had numerous discussions with them, conference calls with them in Region 9, the Congresswoman's office. We know that we're not going to be able to utilize this $170 million before 2019. And we don't have a plan in place. And so for us to be able to come to the table and say, hey, look, we need this money after 2019, this is how we're using it. We got to have a plan in place. And so this Bill 132 actually puts a plan in place and gives us leverage to go come to the table and say, this is the plan that we have to expand Medicaid to provide more access to care for our people. So we know that that's something that is very important, and not having a plan gives us the disadvantage, right? So this puts a plan in place. It also sets it up where we're saying we know from the very beginning this is a pilot. This is a pilot program that we want to establish where we are looking at expanding the eligibility of Medicaid individuals that make over 108% of the federal poverty level, all the way up to 200%. The large number of people that we see that don't have health insurance are the working individuals, the working families. They make over the federal poverty level, but their employers, for some reason, doesn't provide them health insurance, or if they do provide health insurance, they're required to pay 50%, 60%, on an amount that is very high. You know, health insurance is very expensive. With this plan, we are looking at using that 55 cents from the federal government from this expansion money to be able to help this individual purchase an employer-sponsored health insurance premium. So what could be a $3,000 plan that their employer has now, that they require $1,500 coming out of that employee, will now be reduced to anywhere between $300 to $400 a year for that employee. So for discussion purposes, the plan we've used figures based on the GovGuam health insurance plans, the Silver plan, and using those numbers and assumptions, we're able to at least make the presentation to our people on what this may cost them, right? But more than what the cost of what it is financially, the cost of not having health insurance is much, much greater.
Now, let me ask, when you're talking about our people in regards to this now, you're not just talking because we've got folks working GovGuam that under that program as well. We've got, of course, in the private sector that under that as well. So when you're talking about offsets, you talk about a GovGuam offset versus the private sector offset, right?
Sure.
I mean,
yes.
That's so. What is the percentage of GovGuam employees that are uninsured at this point? Because I'm sure there's a percentage, right?
Of unemployed. I know there was a.
Are they? And I guess my question is not necessarily that they're uninsured, because they may be uninsured, but they may be insured by their spouse or significant other, maybe in a private insurance and all that. But do we know how many, the percentage that are really just uninsured, completely not insured?
I think it's very small. I know there was a news report several years ago about some employees not taking on the health insurance. I don't know if we've ever looked into to look deeper to say maybe they don't have a GovGuam because their spouse has coverage. But there's no reason why the government Guam employees should not have. I mean, as people know, we have really one of the richest health plans, right? And the split between the government and the employee is something where there shouldn't be any reason why a government employee does not take on the health insurance. So we've also looked at, if not already established now, a mandate that requires every employee to have insurance, the government of Guam, because this plan that I've put forward is requiring. It's requiring the private and the private businesses to provide health insurance, you know, for their employees, and we're giving them a plan that would, as a pilot plan number one, that would start to get us into that moving forward. You know, it's just like workman's comp.
Sure.
It's something. It's a cost of doing business.
How has this been accepted again in the private sector? In the offset, employee offset versus the employer offset? But before you answer that, I got to take a quick break and pay some bills at this point. Okay.
Great, thank you.
Be right back.